everyone, and thank you for joining our presentation today. My name is Retta Evans, and I am a professor in health education in the School of Education at the University of Alabama.
And I'm Sandra Sims. I'm also at UAB, and I have physical education students that are in schools. So I'm preparing them to be teachers.
So today we are going to discuss kind of the historical context of health and academics, and then talk a little bit about the development of the WSCC model, and then how it can be used as a framework for kind of developing some strategies for mental health care for teachers and students. As we all know, we're in the middle of this craziness right now with COVID-19. And so we're just going to talk through some of those things that are important in the today in relationship to mental health care. So today our presentation is entitled Using the WSCC Model as a Framework for Mental Health Care for Teachers and Students. And so historically, many of you may know that in the past, academics and health were typically seen as very separate entities, very independent domains in the educational system. And so in the minds of many K-12 teachers, health was really thought of as the health teachers' job or the physical education teacher's job. And if you were teaching in the classroom and say teaching middle school mathematics or social sciences or something of that degree, you really didn't think in any way about health or health education or how you could incorporate health, or even that it was your responsibility in any way. So there were a number of models that have been developed in the past that were singular kinds of unrelated models that had a focus on either health or education. And so what you see on the left-hand side, in terms of a little bit of a historical perspective, somewhere in the mid-'80s, the Centers for Disease Control, the CDC, published what we refer to as coordinated school health. And so it's this circular model that you see there. And as you see, it contains 8 elements that include physical education and health services and nutrition. Employee wellness, of course, is very important. Counseling and the psychological services, family, community involvement, the school environment. So it incorporated these 8 elements. But still, yet even with this, the development of this model, there continued to be an uncoordinated kind of leadership and poor collaboration between the various entities to really seek what we truly think of as kind of, total health and well-being for the student. And then on the right-hand side, you see the ASCD, which is the Association of Supervision and Curriculum Development. And in the early 2000s, they came out with this whole child kind of model with these tenets of in order to be successful as a student, you need to be healthy, you need to be safe, you need to be engaged, supported, and challenged. And so this was really the first time that anyone on the educational side had published something that included and incorporated health along with these educational outcomes that we want our students to have. So it was the first time that we had this whole child kind of approach, transforming the relationship between health and education. So during all of this, during this transitional time, there was kind of a dawning of a new era where that this acknowledgement that health and learning are related, in fact, and that they're interrelated, and in some cases, what we might think of as symbiotic. Where, if one succeeds, then the other, then that's going to breed success in, it's going to feed the educational component, and this reciprocal kind of relationship. That health and education impact the individual, impact, relationships, impact society, the school system, this very kind of ecological and symbiotic relationship. And so in and around 2014, this is when the ASCD partnered with the CDC and developed what we now know as the WSC model, which is the Whole School, Whole Community, Whole Child model. And so what's really cool about this model, of course, is that you see the incorporation of both the whole child tenets in the middle, the healthy, safe, engaged, support, and challenged. And then you also see the 8 elements of coordinated school health. But in addition to that, they broke out family and community involvement into community involvement and family engagement. So 2 separate and equally important factors, as well as the physical environment, and then the social and emotional climate, which are 2 different things. They're certainly integrated, but they're 2 important entities in and of themselves. And so this is really the first coordinated effort to show this approach of integrating all of these elements of health education with all of these factors related to academic success. And this is really the first time that we had seen this, although there had been many schools and states in the past that have tried to kind of promote and integrate. This was the first kind of roadmap, so to speak. So, of course, related to all of this, and in relationship to our discussion today of mental health care, Dr. Sims and I have written a textbook for Human Kinetics. This is the 2nd edition, and it will be released, I believe, sometime in March of this year, 2021. And there are a couple of chapters in particular that focus on the WSC model in particular. So, for example, chapter 3 provides a description of the WSC model, and then steps for how to apply the WSC model to all of the different areas of health and well-being, including mental health and stress management. And then chapter 6 focuses on creating a healthy classroom and describes a variety of classroom policies and practices, in particular that support emotional and mental health and well-being. And then, of course, we all know the important role that physical activity plays in stress management and mental health and well-being. And so chapter 7 focuses on creating this active classroom setup, including equipment needs and classroom management strategies, and organization tips for kind of integrating brain breaks and activity breaks and physical activity throughout the academic classroom, to help engage and help in student learning. So, with the recent addition of all of the stressors related to COVID and the restrictions and the isolation and the transition, you can see why this ecological approach of featuring the different components of health education, including physical education and activity and nutrition, the importance of nutrition, and counseling and employee wellness, that there is this connection, in why the ecological approach is so important to mental health awareness and well-being. And so Dr. Sims is going to share some of the research, the latest research on mental health care for teachers and for students.
You know, this has been a very interesting time. And I think that, when Retta and I were looking at this book, we were talking about helping classroom teachers integrate health education and physical education into academics. And that's a tough thing because all these elementary teachers are doing so many things. And then today, here we have this pandemic that's sitting on us. And I'm going into schools right now and I see the incredible stress that teachers are under and administrators. Look, it could be everybody. There's a list of people that are being stressed, but there's no doubt health education right now probably is more important today than it's ever been in schools. And oftentimes when we're looking at, and we'll talk about students in a minute, but we're talking about there's a huge group of people that need help. And I don't know that we all know how to do it. And I think that I'm not an expert in everything, but here's what we know, that we know health education and physical education, the activity, the health components are great benefits for a healthy life and can begin to really help put stress in its place. Now, there's good stress. We need stress. We need stress to get us out of bed. So there is stress that's important. There's an optimal stress that that people could get into and talk about. But I'm talking about this overload, this stress where we've gone over that little rainbow and we're heading down. And we have teachers that are just being inundated with so many things, and students we could talk about, and there's research out there on college students, there's on college professors and all the different things that are going on. We're in higher ed. We know we're feeling it. And I'm going to be honest with you, it's alive and well. Our campus is dead right now. We don't have this, it's eerie when you all of a sudden you come in the fall and the spring and the students aren't here and there's no interaction in the hallways. I need that. I need interaction because I'm a social being. I love that. And so there's stress. So I'm not going to try to say that there's not stress. We have parents that are stressed, but we'd be on this little session for quite some time if we try to hit everybody. So I really wanted to kind of target that K-12 environment because really that was where our classroom book was about, that elementary experience. But we also are going to spread it to the high school because we are seeing some things going on in high school. So here's what we see in Alabama right now. Elementary schools are in session here, where a lot of schools, they have to keep going back and forth. But our middle and high school are it depends on where they are. If it's a varied approach. And so there's within a same house, you have some kids that are they're going into school and the others are on virtual. It really depends on this, what's really happening. And you have teachers that are having to go virtual. And then all of a sudden you have a teacher that they're teaching their class because that's their job. And all of a sudden their kid is at home and they're having to try to also manage this student. So that's an enormous amount of pressure. And honestly, if we don't attend to this social emotional piece, I'm really concerned about what's going to be some fallout. So I want to hit on some things, but Retta, I know that, look, we've both been impacted, not as just as college professor, but as you as a parent, and I have a kid living with me right now that's a special needs child. That's very different. So it's made the whole home life very different. Do you want to share anything that's going on in your world?
Yeah, and I would say, for my son who is a college student, your freshman, sophomore, junior year in college, you're getting out there, and typically you're engaging and you're learning new things and you're interacting and you're hanging out with your friends and you're learning about different types of people and the diverse types of people that they're out that are out there. on the college campus, and that just doesn't exist right now. And so I think I know for college students and for my son, it's very difficult because of the isolation. And I think for many college students, it really is the isolation. And I know that in the classes that I'm teaching, college students are interacting with me online and saying how difficult it is right now, because of the stress of all the chaos, and because of the isolation and lack of kind of socialization with their peers and with instructors, with teachers, and so forth. So I know that that has impacted college students in that regard.
And that's why we're saying, and I know we're not, I know we're not going to miss the college students, because we definitely know that college students, college professors are being impacted. Like I said, I have a young man living with me right now that's sixth grader, and he's a special needs child. He's totally virtual, and it is a challenge. And I'm going to be honest with you, trying to keep him on track and then still continue and do the things that I'm supposed to do as a college professor. There's enormous pressure, but I think that the point is, we have this huge list of things for this special needs child to get done during a day, and the pressure that he feels, and then the pressure that I feel that I've got to get it done with him. It's it's tough. And so some of the things that we're going to come to at the end, these are things that I have to do with Jack every day when we're online, to get him just to be stressed, to reduce the stress, and honestly, to reduce my stress. We have to find ways for outlets. And I think that everybody's going to be different. Everybody's going to have something that's going to work for them, but we've got to move this. And so we've got to address it. It's there. And I do think that that the WISC model gives us some components that we can look at, but I think it's something that we need to do. I want to start off with a study that is recently has gone. It's called Kids Under Pressure. You may or may not have seen this information. It's something that's coming on. It's hot off the press. It is there was a partnership by NBC News and Stanford Graduate School of Education, kind of a nonprofit section of their work called Challenge Success. And they've been doing this kind of a study, and they've looked at, they made it a national study, and they've looked at over 75,000 high school students. And so I said earlier, elementary, we're seeing a lot of elementary students already they're in school, even though it's very different. Many of these high schools students have not gone back to school, or it's all virtual. And so, kind of like Retta was saying about her son, that social component is so missing, and yet the pressures are still there. So there's not a way for them to release this. And when you're looking at the study, they've been doing a lot of this. They've been taking the components out, and I hope you'll have a chance to go back and look this up, because they've done a nice job. They have a nice printable report for you to look at, and it's well worth your time to see some of the things that where they've looked at, and they went from fall 18 to fall 20, and they basically tried to find what was going on with student well-being and academic engagement with the high school students. And what they actually found three different big key findings. And one of the three key findings actually had to do with stress. And I don't think that this is something that would surprise many of you. They're finding all students under pressure. They're more pressurized, but they have found in this study that females in particular are being experienced as high level. Everybody's experiencing it, but they're finding a little markup with females and also students of color. And I think that that's real important for us, that if we have a female that's in your home, that's a high school student, if you have any high school students around, we just need to attend to their needs, because what they're saying now is, whether they're telling us or not, they told in this study that they're experiencing more stress. We already know that that's a tough time. Gosh, do you remember when you were in high school? Good grief, it was just to what you wore, and there was already enough stress just to be a high school kid. And so now we have all this other stuff going on, and it's just heaping on some things. And I think that that's why we're going to see the next bullet said 56% of students report there's a stress, about school. So something that's happening there. And they are saying that there were four major sources: grades and tests. That has always been there. I know we know that. Grades and tests have always impacted some more than others. But now, when they're having to do it on a different format, they're being timed. There's a very different learning setting that's going on. Uh, we have any kind of assessment. In my world, physical education, we're having to do fitness testing virtually, and that is very, very different. So it's hard for students to get into this because we're doing it in totally different formats. But they also are seeing an increase in workload. And I'm going to tell you, from watching what comes through my little computer for a sixth grader, it's tough. It's some high end. Some days are more than others, but by the time in the week, I'm worn out. I'm learning some great things out of sixth grade that I don't remember that I had, but I'm just saying there were some. It's great, but there's a big pressure of getting things done. So there's the workload is there, lack of sleep, time management. Because I have a special needs child, I have to be there, and I am the time management. But I think about those students who don't have somebody there, who don't have somebody that has to be right on top of the student, who is not focused very much. And it's hard. It's hard to engage, and they're learning a totally different way. And again, those things are what are calling these high school kids some pretty high stresses. But just so that you'll know, that there were two other key findings that I didn't put on the slide that the study basically found, and it said the students' engagement in learning is now getting lower. The high school student has starting to drop off. So I think that's the worry, that a lot of these high school students are just getting done with it, and they're just either not getting on Zoom or they're not paying attention. So very tough. So their engagement's dropping. And also the students' relationships with the adults and peers seems to be strained. And a lot, if you listen to some of the interviews of, particularly off of this NBC report, they're interviewing live students, and they're saying, it's not the same. Zoom has been good, but it's just not the same as, I don't know. One student said she didn't even know the person's number, and she really wanted to talk to her. She didn't know her number. And those are real life things. We think today in social media we know everybody. That's not correct. Every kid does not have the same opportunity. So this study is showing that there are some just some real important things that we need to attend to, and we need to be aware of. And sometimes we get kind of tunnel vision, and I can look at just what's happening in elementary, but knowing that this is happening across the country in high school. Okay, so we can't leave off the teachers. Being a public school teacher myself for 20 years, look, I'm going to be truthful. This is a tough time. I'm really glad I'm not teaching right now in the public school. If I had to be totally truthful, it's already enough pressure here in a higher ed. To be in that public school setting, it's extra. There's things that are happening there that I just feel bad for my teacher friends. So teachers are under an enormous amount of pressure, because a lot of them, again, their parents are doing other things at home. But looking at this, there's another study. I want to kind of click onto it. This next study is looking at that basically they did a real quick look at seeing what's really happening. And here's what we really know. And again, I think most of you know this information. Schools weren't ready. We didn't have the resources. We didn't have things available. Teachers, the teachers that I teach, the future teachers, I didn't have them prepared last spring. We were not prepared to go out and teach physical education virtually. I had never gone over how to spray, disinfect balls and equipment between classes. It was never on our prep, any of our course. So there wasn't the structure in a school to be able to handle some of the things. And then when you come back and you now say, hey, you've got to do it all virtually, people were scrambling. There was nothing out there. And so the pressure at first, I know, had to be enormous. And so a lot of the studies that are even reflected, there's some dated studies there. Teachers are already under stress pre-pandemic. I mean, there's already an amazing amount of stuff that happens. There's lack of funding in a lot of schools. Then you drop in this virus, and Lord have mercy, it's just created this, I'm not going to say a perfect storm, but a storm that is causing some major teacher effectiveness. Teachers are getting burned out. They're ready. They're done. They've been asked to do so many things beyond what they're capable and what they've been given resources to do. So for all my teacher friends, honestly, that just staying the course has been amazing. But the work ethic that you're being asked to do, where some teachers have some students in class, so they're doing hybrid, have some students in class and then the others on virtual. Okay, again, you do that in a classroom, you're standing still, but you're doing that in a gym. And all of a sudden you have all this noise. You're trying to, it's crazy. And so again, for my teacher friends that have gone through this, pretty just tough things that you've had to go through. Or this next study was again on teachers, and it was out of Germany. So they looked at different teachers in Germany, and it was interesting. Will you flip to the next slide? Sorry. They did 380 teachers. Again, the N may not be real high for many people, but that's still a pretty good number when you're looking at connecting this, because again, it's sitting in the middle of what all's happening. And what they began to find was that how female teachers were more stressed. Doesn't mean that, just like before, male students were still stressed, but female students tended to be a little bit more stressed. In this case, it seems the same thing, that female teachers seemed that were carrying a little bit more stress, or at least admitted to having more stress. There were gender differences, and they do think they made some adjustments. They made some suggestions that possibly that it was because of the workload at home and the pressures at home. Now, this study went very lengthy, and I didn't want to. It would have made the slide very little, and I didn't want to give you everything, but I just want you to see kind of a glimpse that the workload that these teachers are under just at school, and then add the home, and then the different caregiving, because then we have maybe their parents or a sibling that is getting COVID. They're having to take care of them. That caregiver female, something that's innate, is basically causing, again, some extra pressure. Now, we've talked a lot about, gosh, and I'm really not a negative person, but it's reality. This is real. Now, what can we do about it? And I think if we go back to that model, we're going to see that this model has a lot of things in it. When you start looking at all those components, now we could actually hit stress, and we could talk about it in almost every part of this component. And by the way, I'm so proud of the WSC model. For somebody who is a health educator and a physical educator in public school for years, this makes so much more sense to get this all together, to understand we are dealing with a total child. We're working with total people, and you can't take them as separate. But in reality, as we begin to look at some of the things, we could be on here for a long time telling you some things that we are asking you to do. But a lot of these things, we need to do these during a non-COVID time. In reality, we are overstressed a lot of times. We are, there's so much pressure on students and teachers. We need to be taking attention to ourselves and our self-care. But when we're looking at the WISC components, we could actually go in and highlight so many different things. We know 1996, a seminal document when the Surgeon General came out and talked about physical fitness and how huge that was, how that was a big deal. And for the first time, we had something nationally that said fitness made a difference and the lack of fitness caused death. We had this document that we went, oh man, fitness is important. It's not just, the people we love to be active. Fitness and activity has always played a part of mental health. And many people are talking about what we can do to try to make a change, and honestly, to improve health. And for many of us, it's just to get out of our seats. I was just on a podcast today, and so somebody said, I found myself during COVID sitting more. And I had to wake up and go, hey, she and her husband, she said they were sitting in this new makeshift office that I know many of you probably have. And they all of a sudden now they have office mates. They've never had office mate before. They're in this room, and next thing they know, they're closed in, and they're sitting there for hours that they would never have done before. And what they had to do is had to wake up and go, you know what? I'm not feeling as well. Let's go for a walk. Let's let's get up. Let's just stand up. And I think for many of us, the point is just that we need to recognize. I don't think somebody needs to come in and do a study on you. I think when you feel yourself sinking in the chair. And I think for me, it's just that we know it's there. We cannot do anything about COVID right now, other than hopefully as we're getting the vaccine and things are happening, things are going to happen around us. But the things that we can control are me getting up, and taking care of myself. Me looking at the things, talking to somebody, picking up my phone and saying, "Hey, Retta, we're on a Zoom, and I'm excited that I finally get to see Retta. We're in the same building. We don't see each other here. It's just not that way." And so we have to find strategies at work. And no matter who I talk to across this window of in a non-research basis, just talking to people, everybody has handled it a little differently. And people have found ways, whether they get outside and they're gardening, they're putting flowers. I put loads and loads of sod down in my yard just so that I can have something to do. I think we just need to find something that works for us. Retta, what do you think about this WISC model? Do you think has any impact on the different things that we need to do and how we could actually use that WISC model to help us deal with these stressors?
Yeah, so, and I know that in our textbook, in one of our chapters, I believe it's chapter 3, we talk about, how you can integrate all of these 10 components into different areas of health. So, if we're focusing on mental, emotional kind of well-being and stress management, just thinking about how you could, reach out to the community from the school, reach out to the community, different agencies, different businesses that focus on whether it's a yoga, bringing a yoga class, or some strategies for progressive mental relaxation into the classroom. Or engaging family members. I mean, you can just kind of go around that wheel and think about the different types of action strategies that a school or a teacher could utilize to get to increase their own personal health and wellness, or the students that are in their classes, whether it's virtually or whether it's in the classroom, on ground. So I think each and every one of those 10 components, you could develop specific strategies that target mental health care, emotional well-being and mental health care. So I think it's extremely important, and just kind of a framework to begin thinking about, okay, if we're talking about mental health care, how do we get the community involved? What can I teach in the classroom? How can we get active? What's important in terms of what I'm eating and how that affects my mental health and my stress ability to be healthy. Do I need a trip to the doctor? All of those things, just going around the wheel and thinking about each one of them independently.
I'm glad you said that. And I think that one of the things, the next slide is actually right out of the book. The book has a lot of different examples. And so it was one of the examples that was in the book about what are some things that, in the social emotional health piece, what are some strategies that we could actually work in? And honestly, when you look at this bulleted list, this is not, I don't think that this is rocket scientists. I mean, I don't think that you're looking at something where you're going, gosh, I didn't know that. I think sometimes we need to be reminded, though. I think we need to be able to get up and go, if my favorite activity is dancing, I need to get up and dance. And I'm going to be truthful. Jack has to dance before we even get started. We have to turn on his favorite song. And I'm not kidding. Before I came here today, I had to turn on that favorite song for him to get him engaged, ready to go to school. He has to have something, and it fires him up. And I think we have to find ways to not just wait till we get stressed, but do this thing proactively and get ahead of it. I know that he's going to get stressed. And so I try to pump that blood quick. And look, we can't dance worth a lick, but here's the deal. We have fun and we dance around. And I think that that's the key, is that We don't have to be perfect in what we do. We just have to find something. And honestly, it's what he wants to do. And it's something that's real important to him. And so I think all of us have to find something that we can actually see and say, that makes me feel better. It could be that I just need to get up. I need to stop what I'm doing and rest. Sometimes I just feel overwhelmed. I go, gosh, what's, and I think sometimes we just need to stop and get away from it. I know that as we're writing different things that we're doing, I just have to get away at some point and just stop and go outside and go look at, I know it's cold, but we can go outside and just take that cold breath of air and then come back in and we're good. And I think we need that. We do a lot with brain breaks in the book, in chapter 7, but there's so many. Anybody who's watching this show can actually go on and you just Google brain breaks. You would get an enormous amount. Go Noodle is a crazy video that you could put on for any kid of any age, and teachers need it too. You've got the public school teacher needs it. We do it a lot of times when they just get so antsy, but y'all, we're getting antsy a lot now. And again, all these are things that we need to attend to before COVID. But now all of a sudden you've got all this other extra stuff. We definitely need to not just say, I'll do it tomorrow. We need to do it today. Taking a walk, just going and walking outside, walking around the house. If it's not safe, walk in your, around your sofa. I just think that we need to find time to do a little bit extra. And again, we know studies have shown, and fitness makes a huge difference. You don't have to break a sweat. I know Retta does a lot of aerobic activity, and you would probably say that aerobic activity is pretty high end, that would be something that would be definitely I'm assuming gets your stress down. But some of the students that are in your class, what you said that also is a good way to do it?
Absolutely. Yeah, absolutely. And and there's a lot of research out there that suggests getting out in nature is extremely beneficial in reducing stress. And so just getting out in the neighborhood, if there's a park or if there's a sidewalk that you could get to, um, you know in your area, if there are hiking trails, but even if there aren't, just getting outside and breathing fresh air, I think is has been shown to really kind of reduce stress, just that deep breathing and so forth. So I think that that's important as well.
Oh yeah, that's good. And I think that the biggest thing is, it's just like yoga. I may not be the greatest yoga stretching person, but here's the deal. The breathing, I need that. I need that moment just to be able to just calm it down and feel better. You don't have to be the greatest in any of these things. You don't have to be a great athlete. You don't have to be the best of any of these things. But I think the point is we just need to try something that we maybe not as comfortable with. And look, music, I said it before, it's not on this list. Listening to music is a great relief. And I sometimes I get caught up and I'll just be singing away. And next thing I know, I'm feeling a lot better. I might not have got as much done because I was singing, having a big time, but I needed that moment. And I think that those things are really important to us. We need to talk more. We need to talk to people. I think we need to have friends. We need to check in on people. And I think that that's something that have never been really good at. And social media, there's no doubt it's so easy now to be able to, click and find somebody. For adults, we can do that. For a lot of these students, they're not having that same social, and it's hard for them to talk to somebody. Just like I said before with in that news study, this one girl said, I want to talk to her. I don't know how to get in touch with her. So there's a moment there that I wish that we could find. And I think we're going to learn a ton when we come back out of this. I think we're going to appreciate people. We're going to appreciate things that maybe we took for granted. And I think that that's really going to make us healthier when this all comes through. I think we're going to find to be healthy. But I want to end with this one. Honestly, laughter it is a great medicine. And one of the things that I've found during this window is that I've had a chance to do a podcast with a friend of mine. And, we talk a lot about being zoomed out. And I didn't do the podcast over Zoom, but we started doing them over Zoom. And I get so tickled looking at each other's, whether it's the reactions that we have. But I'm going to be honest with you, my stress level has gone down during this window of me doing of where we're just interacting. We're interacting with friends, talking about some things, trying to have a communication, but the laughter has been enormous. And I'm going to be honest with you, we need to laugh more. I think there's a lot that's on the news. We need to turn the news off sometimes and turn the music on and laugh and find a way to just have fun. And I, the theory, I have a kind of a tagline in my world: finding joy in the journey. It is hard to find joy sometimes in all this darkness, and I do think that that's a very difficult thing for many people that are losing their loved ones. They're being stricken themselves with the different things that are happening with themselves, but either with COVID, with different people that they're experiencing, and trying to find joy in all this has really been a challenge. And I think for many of us, we just got to find ways to find that silver lining. What was it that we wouldn't have done? Who would have not talked to? So in the big picture, health education is so critical all the time, not just during pandemic. But I do think that we're seeing a significant piece here. And I think we got to do something about it. I do. I think we need to start doing more. I'm trying to reach out more to others. And I hope that you will do the same.
Thank you, everybody. We just want you to know how much we appreciate you watching our and listening to our conversation today and our presentation. We wish you the best in your professional endeavors, and we would like for you to stay healthy and safe, and be well.